What is attention deficit hyperactivity disorder, also known as ADHD? The CDC tells us that ADHD is one of the most common neurobehavioral disorders of childhood, meaning it is a disability associated with brain function. Let's talk about the types of ADHD. There are 3 different types, and the symptoms for each vary from mild to severe. The first type is predominantly inattentive type, where a person finds it hard to pay attention, is easily distracted, and forgets details. The second type is predominantly hyperactive impulsive, where a person might feel restless and impulsive or have difficulty being patient. The last type is combined, where symptoms of both inattentive and hyperactive impulsive are equally present. A child with ADHD might show the following common symptoms. They might daydream a lot, forget or lose things, squirm or fidget, talk excessively, make careless mistakes, take unnecessary risks, have a hard time resisting temptation, have trouble taking turns, and or have difficulty getting along with others. Boys often present with combined type of ADHD, while girls present with predominantly inattentive type. So who can be affected by ADHD? Well, anyone. There is no age limit, although many people are diagnosed in their childhoods. And the disorder often lasts till adulthood. The estimated number of children diagnosed with ADHD ever, according to a national 2016 parent survey, is 1 in every 6.1 million people, which is 9.4% of the population. Boys are more likely to be diagnosed with ADHD than girls, with 12.9% comparing to 5.6% in girls. You might be wondering what could cause ADHD. There is no clear cause, but scientists have discovered certain factors that might make a person more prone to having it. Some risk factors for children include genetics, brain injuries, and premature birth. So how do we test for ADHD? You can talk to a primary care physician and have a medical exam, including hearing and vision tests, to rule out other problems with symptoms similar to ADHD. A medical professional can then review the DSM checklist for rating ADHD symptoms and take a history of the child from their parents, teachers, and sometimes the child themselves. There are also specific tests that can confirm ADHD diagnoses. These tests, called neuropsychiatric assessments, are done by a neuropsychologist and are 10 to 15 hour-long tests spread over a few days. These neuropsychiatric tests also help to rule out other conditions like learning disabilities or executive function challenges, which are often present alongside with ADHD. To learn more about this disorder, check out our second segment of the ADHD video series, which will be posted shortly.